Okay, so this will be my last gallbladder video besides the post-op day video, which will be super short, and maybe my 3-month, 6-month, or 1-year follow-up video of how I'm doing or tolerating life without a gallbladder. So, okay. So, the incisions that were made, I'm going to show you guys mine, was this one. And it has like a little, some stitches there. And it had glue on it. And then this one, well, 4, there's 1, 2, 3, 4 small ones that's got some glue left. And then my belly button, which had something like, I'm trying to see, in there, and then at the bottom. And it just, and then I have 2 over here. This one still has glue on it. And then there's that one. This one hurts the worst. And I'm scared I'm not going to be able to put my belly button ring back in. So they're not infected or anything. They might look kind of gross, but so I had taken a couple showers, and the glue was peeling up, and because I didn't like it, I just peeled it off, and I probably shouldn't have, but I did, and they're healing nicely, so it's okay. But I did peel my glue off, and like I said, I still have two stitches in the top abdomen, incisions, so I'm not sure if they're supposed to take those out or what's going to happen with those. They weren't even mentioned in my medical chart. My medical chart thing whenever I left the hospital. They didn't tell me about them. I found out about them whenever I removed the glue myself. And I think it's better to remove the glue anyway before going to your post-op visit, so that they can make sure that, you know, they're healing the way that they're supposed to or whatever. So coming home, I could not sleep in my bed because the pain was like just too bad. I couldn't drive for like, it's been almost 2 weeks, and I'm just now driving, and driving is kind of hurting me worse because of the seatbelt and stopping and stuff like that. But anyway, so I had to sleep on my couch, and normally, you know, well, I guess my couch isn't really comfortable for just having your gallbladder taken out, but it's comfortable to hang out and watch movies on, but it's definitely not, you know, maybe a nap, but it's not something you want to sleep on. So, the first night I slept on the worst side of it, and then I slept for like a week and a half or almost 2 weeks on the other end of it, because it's like a wraparound. So, and I had my pillows and my blankets, and sometimes I would use a pillow for my feet to kind of like prop them up. But anyway, so the sleeping part of it is not fun. The first couple nights I was still coming off of the medications, and so I did get some good sleep or whatever, and I wasn't in much pain. They did prescribe me pain medication that was time released. I didn't know that. So I would take one and it would not work, so I would take another one, and then I would get really, really sick. They were just 5 milligram general pain medication. I'm not going to say the name of them, but they were general pain medicines, which I totally hate pain medication, period. But it would help the pain go away, but the feeling afterwards of it wearing off, the feeling, it just makes you sick, or makes me sick. I just hate narcotic pain medication. I just can't stand it. But anyway, so I would take you know, a couple of those I would take normally, like I said, 2 at a time, because I didn't realize until I got like to the bottom of the bottle that they were time released. So anyway, I would do that. I did not take any ibuprofen or Tylenol. Still haven't, still won't, because that increases the chance of internal bleeding, and I don't want to do that. So anyway, sleeping was very, very uncomfortable for the first week. I walked hunched over and also holding my stomach, bracing myself, you know. So walking was kind of hard. Walking is definitely getting easier for me now. I still have my moments, but walking is definitely getting easier. And so when you sneeze, when you cough, it hurts extremely bad. When you're sleeping, you wake up and you do a little stretch. That top incision right here in the chest, sharp, sharp pain. So, they blow your stomach up during the surgery, and you have a lot of gas, and it's not your fault, you know. And you also got to learn to live with having gas extremely, like, right under your liver now, because I previously mentioned that the gallbladder is above your liver, and it's actually a pear-shaped organ that is up underneath your liver, which is very weird considering the gallbladder pain is above your liver when you know, touch it or whatever. And I'm having some pain in that area now from driving. Like I said, I think it's from the seatbelt. But anyway, so coming home and sleeping was very uncomfortable. You have to sleep on your back. I've been sleeping on my side now, and every morning I regret it because it hurts very bad waking up in the right upper region and the lower right side. The gas pain is very extreme in the lower right region. It's unbearable, and I was just not holding it in, no matter who you're around, because it hurts. And if you don't let it out, it's just going to sit there and hurt. So that is that part. My movement and mobility were very, very extremely limited because of the pain for the first week and a half. I would suggest getting one of those TV type pillows that have the arms on the sides, because that would help you get up and down, because if I laid flat, I had to be helped up. And the pushing and pulling and tugging of my hands and arms of people trying to help me get up definitely made my pain worse. So if I would have been able to had one of those little pillows like the TV type with the arms, then I could have gotten up and down easier on my own. Going to the bathroom, urine went back to normal within a couple of days. And it was kind of dark colored. At first it was light colored. I probably need to drink less sun drop, more water. That would probably help that. Bowel movements are the first week are gonna be as soon as you eat something, you're probably gonna rush to the bathroom within 10 minutes. And it sucks, but you know. And there's still going to be, like, diarrhea episodes here and there. But I have had a few normal bowel movements, which were, like, solid. They weren't, you know, the running or whatever. So, anyway, I have had a few normal ones. I guess it just depends on what I'm eating. The first few days, I didn't want to eat anything but Jell-O. You know, like, you should probably drink water. I was able to drink Sundrop, but as soon as I drank a Cheerwine, I threw it right back up. And like I said, I don't know if it's due to a cold, but the first few days I was coughing up blood. Like from my chest. And they told me not to smoke, which I do smoke, and I still have not stopped. I'm trying to, but I haven't yet. And they did give me the I can't remember what it's called, but it's the little thing that you hold and you put it in your mouth and you breathe like this, and it goes up and down. I have been doing that. I should probably do that some more. But at first, it hurt to breathe in for like 6 days. It hurt to breathe in. It hurt to talk sometimes. I just couldn't even talk. Yelling was out of the question. So I had to, you know, remove several toxic people away from me that just wanted to try to make me yell for whatever reason, because that's what they like to do. But anyway, so My breathing, let's see. When I breathe in, I can't take a deep breath, but I do still feel some pain and a side stitch, you know, like when you run too much. I got a little side stitch in my right side still when I try to breathe in deep, but it is only week 2. So hopefully in a month that will go away. Hopefully sooner, but I'm thinking a month it should be gone. Sneezing and coughing, you better use a pillow or just hold your stomach in because it totally hurts. And I was sneezing and having, you know, the coughing the first few days, and that sucked. And so, like I said, I would eat Jell-O. Then I tried, like, some chicken noodle soup with crackers. And, thankfully, my boyfriend was able to cook our Christmas dinner, which was quite lovely because there was no way I could have stood up and did that. And, I did cook the whole Thanksgiving by myself. So, I think that was, like, a favor. Anyway. So I ate that, and, I was able to hold that one down for a while, you know, and then the second time I had a second plate of it, it was, like, to the bathroom. But anyways, I've noticed now that certain fatty, like, if I eat a lot of fat, then I'm going to immediately be in the bathroom within, like, probably 30 minutes. But if I'm eating a regular, you know, healthy, balanced, nutritional meal, or even just a candy bar, then it's going to stay down longer, and I'm not going to have that running to the bathroom feeling. And I'm hoping that that goes away soon as well. And all that extra gas and bloating, that's got to go. Like, I don't know, but that's got to go. My friend did give me some charcoal gas pills. Those help tremendously. So I would recommend that you buy those. She had some from CVS, but they are the charcoal. And they're for immediate gas relief, and they immediately relieve the pain that I was having. Like, I could not pass gas for, like, 3 days, and it hurt really, really bad. But as soon as I took 2 of those, like, it was coming, and it's still coming. So, anyway, you know, and I'm totally shy to, like, do that around people. It's normally normal bodily function, but, like, at this point, I do not care. I'm not holding it in. I don't care if I'm in Walmart and you're behind me. I'm gonna fart, buddy, okay? Because it hurts. But anyway, I'm just letting y'all know, do not hold that in, okay? Seriously, let it out, because if you don't, it's gonna hurt, and it's gonna make your breathing worse. You won't be able to breathe, and you probably won't be able to walk. So, like I said, that was the first week. The main thing is to rest, okay? And sleep as much as possible, because when you sleep, your body heals itself. And, I would suggest taking vitamins, which I need to do myself. And, also elderberry, just because elderberry is a bomb, which I need to do some more elderberry. And also take your shots of the apple cider vinegar. And as soon as I do these videos, I'm probably going to do all 3 of those, because I need some vitamin D in my life right now. But anyway, so, no more gallbladder. I have, when you wash it, like, when you wash the areas, like, I have a shower chair, which is, like, super, like, messed up. I think it needs, like, to be screwed or something, like, screwed in better. But anyways, or maybe it's just my bathtub mat, I'm not sure, but it leans to the left, and it totally scares me because I feel like I'm gonna fall off of it. But for right now, I'm using my shower chair. I do not feel comfortable standing up taking a shower. I will take a bath once I'm cleared for that, because I just had a leak procedure, and I can't take a bath because of my cervical issue, my cervical procedure I had done. I can't take a bath yet. And I go this week to check on that, so hopefully they'll clear me so that I can have a bath, which would be wonderful right now. Plus my friend gave me these awesome bath bombs that I want to use, and I have Epsom salt, and, bubble bath, and that's, like, gonna be amazing. But anyway, right now I have this, since I peeled the glue off, oh my god, and let me tell you, when I peeled the glue off, I don't know if I'm allergic to it, but I itched tremendously. Like, I was itching so bad. I don't know what was going on, but there were bumps all over my stomach, all over my back, all over my arms. And I also tried this new lotion. So once I took that shower and rinsed off or whatever, the itching did go away, and I'm still having some itching because I think I still have some of the glue left on me, so I'm not sure. But I used this, and this is just like regular Blue Star ointment, medicated itch reliever with aloe, the original, and it stops itching fast. So I just used some of that for the bumps and the itching that I had. And like I said, I don't know if it was due to the glue or the lotion, but whatever. And this is actually a spray Neosporin right here. And it's only got a little left because I've used a lot. But anyway, I'm just going to spray that. I've been spraying that on there, and that's helped. And once I get done with that, I have some medicated ointment that prevents infections and open wounds. And once I run out of my Neosporin, I'm going to use the cream on there, on the incisions. But I'm not using it just yet until my post-op appointment to make sure that I can do that. Then once I'm done with that, I have Mederma. And once these incisions are fully closed, I plan to use my Mederma to get rid of the scarring. And Mederma has worked for me for scars in the past. And it's very awesome. So I'm going to use that. And, of course, cocoa butter, which also helps. And I also have, like, some cocoa butter cream that works for scars and like dark aging spots, etc., whatever. So I'm going to use that, the Mederma and the cocoa butter stuff whenever I get done, when the incisions are fully closed up. So that's what I'm going to do. That's my plan. But I would just suggest eating Jell-O, soups, broth. My cousin recommended the Bright Diet, which is like toast, Jell-O, soup broth, things like that. And I would say do that for like the first week or two. I've been able to eat onions without any issues besides running through the bathroom, but that could have been because I ate like a whole total plate of Christmas dinner plus dessert, because I was that hungry. I mean, like, eating like nothing for 2 days and then Jell-O is gonna make you hungry. So but I cannot wait to have a bloomin' onion once I can get to one, or some onion rings. That would be great. And I'm gonna try that out and see what happens. I'm hoping that the gallbladder and the onion thing was related, and that it's just not something in my body that's just like rejecting onions, because if I do eat an onion and then I do have a problem, then something else is wrong, So, anyway, like I said, I would just suggest like getting a TV chair pillow, resting comfortably with lots of pillows, lots of soft blankets, maybe put your feet up, reading books, whatever it is that you want to do, watch Netflix, TV, play with your kids from the couch like I did, and just like video chatting people or posting your social media stuff or whatever it is that you do from your couch, because you can't really get up and do anything else. And I had to do Christmas and wrap presents like this, and it was like not fun at all. Like I said, I could breathe a little easier. I can walk a little better. So I could tell that the healing process is coming and starting. And I have had some low-grade fevers on and off. I'm not sure if that's due to me having some type of respiratory illness or bronchitis or whatever. My throat was not sore after the tube was down my throat. It was sore in the hospital, but not when I got home like they told me it would be. So I don't know what that was about. It almost felt as if they didn't even put a tube down my throat. So I don't know. But it at first it really feels like it's like your liver, because your liver is cauterized. Like they burn it. They burn the gallbladder from the liver, and that hurts. It still hurts to press, especially around the incisions. it's just weird. It's just a weird thing. Like, and as I'm feeling my ribs right now, but I'm feeling like under my incision, there is like a serious, weird, inflamed knot. I don't know if any of you other guys have had that happen, but that's weird. But anyway, that it still itches. I don't know what's up with the itching, but my friend Nicole had her gallbladder removed a year ago and said that she still gets the itching. I've also read that other people do as well. I'm not sure if maybe, because, you know, when your liver can cause itching. So maybe the liver processing all that bile now, maybe the liver is causing the itching. I'm not sure. But anyway, so I'm still not 100% healed. When I went back, I had to go back to the emergency room because I wanted to make sure that I did not have a UTI, because the antibiotics they gave me caused a severe allergic reaction, and they told me, instead of being nice and writing me a new prescription, that I had to go back to the ER. And there I was told I did not have a urinary tract infection, so I did not get antibiotics there. But I did, however, have a CAT scan. And then I had an x-ray of my femur bone, the top of my leg, my hip bone, that showed a lytic lesion, which is a hole through my bone. And so Friday I go to a regular doctor to get a referral and follow-up MRI of that. So I'm hoping that that goes well, and that we figure out why I have a hole in my hip bone, because normally it's caused by cancer. They can be benign, and I'm hoping that mine is benign. So pray for me that that will be benign, because I'm like super scared of that. Like, I just had cervical cancer cells removed. I have a pap smear follow-up in a year, and I'm hoping that that one shows normal, because I don't want to have another stupid leak procedure. I plan on ordering some vitamins that will help with the cervical situation, and I will share those vitamins with y'all once I order those, but it's going to be a few months probably, because I have a lot of bills. But anyway, so as far as everything else goes, I will update on my LEAP procedure follow-up and my post-op appointment for my gallbladder. I will update on that. And I will update on the MRI results, and hopefully they'll be okay, and I won't need to be referred to an oncologist, because that's scary. And I keep getting these low-grade fevers on and off. Maybe because I'm doing too much. I probably should not be walking around moving a lot. It's only week 2. So, yeah. Or no, it's like almost week 3, I think. I don't know. But anyway, so like life has to go back to normal, but I think that I should probably take it easy and rest more, and not try to do everything at once or be up moving around too much, because it seems like the more I'm up moving around, the more low-grade fevers I'm having. And that could still be just from recovering, you know, like maybe the recovering is causing the low-grade fevers. But I don't have high fevers. I'm not having any jaundice in my eyes or skin. My incisions did turn purpley bluish yellow, and I was freaking out thinking I had jaundice, but those were just like bruising or whatever, which was normal. But you can't take a bath. You cannot take a bath anyway. Even if you didn't have the cervical thing, you can't take a bath. You have to take a shower. And sponge baths would probably be recommended if you don't have a shower chair. But anyway, you should not like hold water on the incisions at all, especially if there's glue on them. If the glue is off, you can hold water on it. You could pat them dry, but I would suggest not patting them dry, because the fibers and stuff like that can get into the incisions. So I would just recommend like letting them air dry. So anyway, I will do a post-op appointment little short video update of what the surgeon tells me and suggests, and then I will do some more updates. As of right now, I still don't feel that great, which is to be expected. The internal organs and the liver and all that stuff, everything inside takes about 6 months to 1 year to fully heal and to fully go back to normal. That doesn't mean it's going to take yourself in general to go back to normal. That just means that the inside healing process is a lot longer, and the outside and inside healing process is going to be a lot longer if you smoke. So try not to smoke. My best advice. I'm trying not to smoke as much, but I wouldn't smoke at all if I didn't have such toxic family that I have to deal with, and people that I deal with daily that are just toxic sometimes. And I hate smoking. I wish I never started, but it's like a safety blanket to me. It's like, it's always going to be there. If I'm angry, if I'm upset, I can have a cigarette and I'm good. And it really is pathetic that I don't know what to do without having a cigarette in those types of situations, because taking a walk for me is just not doable. I have kids. I can't just run off and be like, oh, I'm mad, I gotta go take a walk. No, I can't do that. Listening to music could help. Playing with little squishy thingies, that could help. But anyway, I'm trying to quit smoking, and I have some Quiltline products that are nicotine lozenges. I'm going to try those. I'm probably going to try those soon and try to quit smoking. But anyway, that has been my healing process and my recommendations to y'all if y'all are going through the same thing. And if you have any recommendations for me that I did not mention, please do let me know. Also, I would say, instead of heating pads for recovery, I think, cold compresses, over a rag or over a blanket would help. Which, I don't really have any gel packs. I just have those big lunchbox, ice freezer packs. I don't have any gel packs I could make cold and, lay over the incisions. But I think cold would be good for those. And, of course, the cold rag on the head. Who didn't want that when they were sick as a kid? That totally helps. But anyway, so if you guys have any suggestions for me, let me know. And again, like I said, most blessings and well wishes for 2022 for me, for you, for everyone. And this will be my last video until my post-op appointment. So this has been gallbladder recovery. No more gallbladder. Life without a gallbladder. And I'm kind of glad it's gone. I don't have to deal with that anymore. And I can eat onions. That makes me happy. Alright, so excuse me. I'm ratchet. I'm in the bed. Don't care. Anyway. So, like I said, just leave some comments down below. And please do not forget to subscribe. Okay? Have a wonderful, happy New Year.